Hello and welcome. Today we'll be exploring a complex kidney disease called focal segmental glomerulosclerosis, or FSGS. We'll delve into its causes, how it affects the kidneys, its symptoms, diagnosis, treatment, and more. Join us as we unravel the intricacies of FSGS. So what causes FSGS? The etiology, or the root cause, can be a complex puzzle. In some cases, it's idiopathic, meaning the cause is unknown. This is called primary SGS. However, secondary FSGS develops as a consequence of other conditions. These include genetic mutations, certain infections like HIV or parvovirus B19, drug abuse, obesity, sickle cell disease, and even conditions that reduce the number of nephrons, such as kidney removal or reflux nephropathy. In essence, FSGS can be a primary problem or a consequence of another underlying health issue. Now, let's talk about how FSGS affects the kidneys. The pathophysiology revolves around damage to the glomeruli, which are the filtering units of the kidneys. Focal means that only some glomeruli are affected. Segmental signifies that only parts of the affected glomeruli are damaged. Glomerulosclerosis refers to the scarring, or sclerosis, of these segments. This scarring disrupts kidneys' ability to filter blood effectively. Proteins which should remain in the bloodstream leak into the urine, leading to proteinuria. Over time, this progressive damage can lead to chronic kidney disease and ultimately, kidney failure. Understanding how common FSGS is can help us assess its impact. While not the most prevalent kidney disease, it represents a significant proportion of cases of nephrotic syndrome, particularly in adults. Studies estimate that FSGS accounts for roughly 15% of cases of nephrotic syndrome in children and up to 40% in adults. Certain populations, like African Americans, have a higher incidence of FSGS, emphasizing the importance of understanding risk factors and targeted screening. The signs and symptoms of SGS can vary from person to person. Proteinuria, or protein in the urine, is a hallmark. This protein loss can lead to swelling or edema, especially in the ankles, feet, and around the eyes. Other symptoms may include high cholesterol levels, high blood pressure, fatigue, and foamy urine. In severe cases, kidney function declines, leading to symptoms associated with kidney failure, such as nausea, vomiting, and loss of appetite. Diagnosing FSGS involves a combination of tests and procedures. A urine test will typically reveal proteinuria. Blood tests are conducted to assess kidney function, cholesterol levels, and other indicators of overall health. However, the definitive diagnosis requires a kidney biopsy. In this procedure, a small sample of kidney tissue is examined under a microscope to identify the characteristic scarring pattern of SGS. FSGS can be further categorized based on its underlying cause and microscopic appearance. As mentioned earlier, we differentiate between primary and secondary FSGS. Furthermore, pathologists classify FSGS into different subtypes based on the patterns of glomerular damage observed under a microscope. These subtypes include collapsing variant, tip lesion variant, cellular variant, pareillar variant, and not otherwise specified. Identifying the specific subtype can sometimes provide insights into the underlying cause and potential treatment strategies. Treatment for SGS focuses on reducing proteinuria, controlling symptoms, and slowing the progression of kidney disease. Medications often include ACE inhibitors or ARBs to lower blood pressure and reduce protein leakage. Immunosuppressants like corticosteroids or calcineurin inhibitors may be used in primary SGS to suppress the immune system's attack on the glomeruli. Diuretics help manage edema. Lifestyle modifications such as a low-sodium diet and regular exercise are also important. In advanced cases, dialysis or kidney transplantation may be necessary. Unfortunately, there's no guaranteed way to completely prevent FSGS, especially the primary form. However, managing risk factors associated with secondary SGS can be beneficial. This includes controlling high blood pressure, managing diabetes, maintaining a healthy weight, avoiding illicit drug use, and treating underlying infections promptly. Regular check-ups and urine screening can help detect proteinuria early, allowing for timely intervention. The prognosis for SGS can vary significantly depending on the underlying cause, the subtype of FSGS, and the response to treatment. Some individuals experience a relatively slow progression of kidney disease, while others may progress to kidney failure more rapidly. Research is ongoing to identify new therapeutic targets and improve treatment outcomes. Current research explores the role of genetic factors, podocyte biology, and novel immunosuppressive agents in FSGS. Understanding these factors will hopefully lead to more effective and personalized treatments in the future. Thank you for joining us on this exploration of FSGS. Stay informed, stay proactive about your health, and remember that early detection and management are key in navigating this complex kidney disease.